It can be a deeply unsettling experience. You feel unwell, noticing symptoms that align with early HIV infection. You get tested for HIV, seeking clarity. However, the test result comes back negative. Relief turns to confusion as symptoms persist. This scenario is more common than you might think. It raises questions about your health and test reliability. The human body is complex, and symptoms can overlap. Symptoms like fever, fatigue, and sore throat prompt a search for answers. A negative test can feel like a dead end if symptoms persist. A negative HIV test is generally reliable but not always final. We need to explore reasons for this discrepancy. This essay aims to explain why symptoms persist despite a negative HIV test. We will discuss the window period and other conditions with similar symptoms. When HIV first enters the body, it begins to replicate rapidly. This initial phase is often referred to as acute HIV infection or acute retroviral syndrome, ARS. During ARS, the immune system recognizes the virus as a foreign invader and mounts a response. This is when many people, though not all, experience symptoms. These symptoms are often described as being flu-like or similar to mononucleosis. They can include fever, fatigue, rash, sore throat, swollen lymph nodes, muscle and joint aches, headaches, and sometimes nausea or diarrhea. These are general signs that your body is fighting off an infection. The symptoms of acute HIV infection typically appear within 2 to 4 weeks after exposure to the virus. They can last for a few days or several weeks. Because these symptoms are so general and can mimic many other common illnesses, they are often overlooked or misattributed to something less serious like a common cold or the flu. This is one of the reasons why HIV can sometimes be transmitted unknowingly during this early stage, as the infected person may not realize they have HIV. The viral load, which is the amount of HIV in the blood, is extremely high during acute infection, making individuals highly infectious. It is important to note that not everyone who contracts HIV will experience noticeable symptoms during the acute phase. Some individuals may have very mild symptoms, or none at all. There are several different types of HIV tests available, and they work by detecting different things. The most common types of tests look for HIV antibodies. Antibodies are proteins that your immune system produces when it encounters a harmful invader, like a virus or bacteria. It takes some time for your body to develop enough antibodies to be detected by a test. This is a fundamental concept to grasp when interpreting test results, especially in the context of recent potential exposure or early symptoms. These antibody tests can be performed on blood or oral fluid. Another type of test is the antigen-antibody test, often called a combination test or a fourth-generation test. These tests can detect both HIV antibodies and a part of the virus itself called the P24 antigen. The P24 antigen is a protein found on the HIV virus, and it can be detected in the blood sooner than antibodies. This means that antigen-antibody tests can often detect HIV infection earlier than antibody-only tests. These are now recommended as the preferred initial screening tests in many settings because of their ability to pick up earlier infections, shortening the window period. Then there are nucleic acid tests, or NATs. The window period is a term you will hear frequently when discussing HIV testing. It refers to the time between when a person is first infected with HIV and when a specific HIV test can actually detect the infection. During this period, someone can be infected with HIV and be able to transmit the virus, but their HIV test result may still be negative. This is because the test is looking for signs of the virus or the body's response to it, and these signs take time to develop to a detectable level. This concept is absolutely central to understanding a negative test result in the presence of symptoms. For antibody tests, the window period can range from about 3 weeks to 12 weeks, or 23 to 90 days, after exposure for most people. The body needs time to recognize the virus and produce enough antibodies to be picked up by the test. If you get tested too soon after a potential exposure, before your body has produced a detectable level of antibodies, the test might come back negative even if you have been infected. This is a common reason for a false negative result in the early stages of infection, and it can be a source of significant anxiety if symptoms are present. Section 5. Beyond the window. Other reasons for a negative test with symptoms. While the window period is the most common reason for a negative HIV test despite early infection, there are other, albeit rarer, possibilities to consider if symptoms persist. One such factor could be related to the specific type of HIV. There are two main types of HIV, HIV-1 and HIV-2. Most HIV tests are designed to detect HIV-1, which is the most common type worldwide. Some tests also detect HIV-2, but if a test is specific only to HIV-1 and a person has contracted the less common HIV-2, the result might be negative. This is more of a concern in regions where HIV-2 is more prevalent, such as West Africa. Another very rare scenario involves individuals who have an atypical immune response to HIV. Some people, sometimes referred to as elite controllers or those with specific genetic factors, might control the virus exceptionally well, leading to very low viral loads or delayed antibody production. In such extremely rare cases, standard tests might take longer to become positive or could, in theory, be more challenging to interpret. However, this is not a common occurrence and modern tests are very sensitive. It's a possibility that medical professionals might consider in complex diagnostic cases but not a primary explanation for most. One of the primary reasons you might experience HIV-like symptoms despite a negative HIV test is that many other common illnesses share a similar initial presentation. Influenza, commonly known as the flu, is a prime example. The flu is a viral respiratory illness that can cause fever, chills, muscle aches, fatigue, sore throat, and headache. All symptoms that can also occur during acute HIV infection. Given that flu season occurs annually and affects many people, it is a very plausible alternative diagnosis if your HIV test is negative. Another common culprit is infectious mononucleosis, often called mono or the kissing disease. Mono is typically caused by the Epstein-Barr virus, EBV, and its classic symptoms include extreme fatigue, fever, sore throat, and swollen lymph nodes, particularly in the neck. These symptoms can be quite severe and can last for several weeks, closely mirroring the symptom profile of acute retroviral syndrome. Many young adults and adolescents contract mono, and it can easily be confused with early HIV if there's a background of concern about HIV exposure. Strep throat, a bacterial infection caused by Streptococcus pyogenes, can also cause a severe sore throat, fever, and sometimes a rash or body aches. While swollen lymph nodes are common, the overall symptom complex can overlap with early HIV. Beyond common infections, other health conditions can present symptoms similar to acute HIV. Autoimmune disorders like lupus or rheumatoid arthritis cause fatigue, joint pain, and rashes. These conditions involve the immune system attacking the body, leading to inflammation. Certain STIs like secondary syphilis can cause rashes, fever, and swollen lymph nodes. These symptoms can overlap with those of acute HIV. Stress or anxiety can also manifest with physical symptoms like fatigue and headaches. The mind-body connection is powerful, contributing to physical unwellness. If you have received a negative HIV test but continue to experience symptoms, or if you are concerned about a recent potential exposure that might still be within the window period, it is absolutely essential to seek or continue medical consultation. Do not dismiss your symptoms simply because one test was negative. Your doctor is your best resource for interpreting your test results in the context of your specific situation, including the timing of potential exposure, the type of test performed, and your individual health history. They can provide guidance on whether retesting for HIV is necessary. Depending on the circumstances, your doctor might recommend a repeat HIV test. If the initial test was an antibody-only test taken early in the window period, they might suggest a fourth-generation antigen antibody test or even a NAT. If the window period for the most sensitive tests has clearly passed and results are still negative, they will then focus on investigating other potential causes for your symptoms. This could involve further blood tests, imaging studies, or referrals to specialists, depending on what conditions are suspected. Open communication with your doctor is key. It's also important to be honest and thorough when discussing your symptoms and any potential HIV risk factors with your healthcare provider. Experiencing symptoms that you associate with HIV only to receive a negative test result can be confusing and stressful. The window period for HIV tests is critical. A test taken too soon may not detect the virus. Other conditions like the flu or other STIs can mimic HIV symptoms. A negative HIV test should prompt investigation into other causes if symptoms persist. Listen to your body and seek professional help to understand your symptoms. Open communication with your healthcare provider is essential.